Hi, everyone. This is Kristen Egger. Today's healthcare topic in the IDChat Podcast series is on Enterprise Master Person Index, or commonly known as EMPIs. These solutions are heavily reliant on the quality of data to accurately match patients to their correct records, which, as we've learned, can lead to misidentification and duplicate records. Joining me today to continue our conversation is Catherine Schulten, and she is the VP of Product Management at LifeMed ID. Thank you for coming on today, Catherine.
Thanks for having me.
A few episodes back, we briefly touched on EMPI performance. Today, I'd like to dive a little deeper into that topic.
Sure. We had a really good conversation about the role of EMPIs, or Enterprise Master Person Indexes. A lot of hospitals have that sort of technology. Either they've purchased it independently from a vendor, or it comes embedded in their EMR, and sometimes the EMPI solution might be within their integration engine. But however they've acquired their EMPI, it is a key piece of infrastructure to their organization, and it is one that is very useful. However, it is dependent on the quality of the data that it receives. The old adage, garbage in, garbage out. So we like to talk about the usefulness of the EMPI in conjunction with the LifeMed ID EMI solution.
What exactly is garbage in, garbage out?
Well, EMPIs consume or are sent data that comes from typically the patient registration process. So the PII, personally identifiable information, that comes during the registration process can have a whole host of issues around the quality of the data. It could have data transpositions, it might include misspellings, it just might be incorrect altogether. But that's the data that the EMPI has to use, and it is that data that it relies on in order to facilitate matching. So if the data is poor, you're going to get bad results. Poor data, poor results. What we encourage is that the EMPI be fed, if you will, good quality data. So data that has been vetted or verified. And some of the ways you can get really good quality data is through verification processes. There are third-party services, for example, out there that can provide during the enrollment process verification of the person's address, for example, or their correct legal name and name spelling. These are examples of vetted data. You could also get vetted data directly off of the individual's driver's license, for example. That's a good piece of evidence that shows exactly what that person's legal name is, and date of birth, and their driver's license number. So these are pieces of information or processes that help to enhance or improve the quality of data that the EMPI ends up using.
If I moved last year, and at that point of time, I was at one facility, a hospital, and then I moved and went to another, would the verification process be able to identify my previous address?
That's a great situation, and that's a very common use case. So often when a patient comes to the hospital or goes to the clinic and they have older or not verified data on file about you, they will often ask you this question. They will say, is this information still correct? And if you don't know that they're necessarily looking at your old outdated address information, you might incorrectly say, yes, that information is proper. And it turns out it's not. So what the organization should be doing is not just asking you to verify that the address is correct, but actually using a third-party verification service to do an identity verification transaction. So, for example, they could send a query off to an organization like TransUnion, for example, and TransUnion could provide response back that says that is no longer your current address and this is your current address on file. So that way the hospital would be aware of and would note the more current information that has been verified.
To learn more about how EMI improves EMPI performance, visit lifemedid.com. Catherine, thank you so much for joining us today. And to all of our listeners, stay tuned, same time next week for our next IDChat podcast topic.